Welcome back to the AI Academy for our next session. Dr. Nikica Zaninovich will address the application of image analytics in the embryology lab. Nikica is currently the director of the program at Cornell. He has his Ph.D. from the University of Zagreb and holds the HCLD credential. Nikica, thanks so much for taking time to comment and give us your perspective regarding how the image analytics and AI can be applied in the laboratory for better outcomes. Thanks so much.
Hi, my name is Nikica Zaninovich. I'm associate professor and lab director at Weill Cornell Medicine. And the title it was given to me, it's to discuss about image analytics in the IVF lab. Is it a game changer or an effective add-on? For this particular talk, I don't have any conflict of interest. I am, however, associate and a consultant for numerous IVF AI companies, but nothing to be conflict for this particular talk. So the learning objectives will be to describe the capabilities of AI within the context of IVF lab. It's to review the current and possible future applications of AI in IVF lab, touch base on the automatization and robotics, and talk about some future methods or technologies that can come up in the near future for the IVF lab and IVF in general. So to start with, we actually have to start with some other things than just artificial intelligence. We have to talk about intelligence or human intelligence in general. So we need to notice that there are different types of human intelligence. There are actually 9 different types of human intelligence. So one person can be very intelligent for one type, let's say musical, but it doesn't need to be very highly intelligent for some other types, like let's say physical or sports, and vice versa. So we need to include all these different types of intelligence. So if we are talking about artificial intelligence, that means that we also need to create different type of artificial intelligence that will actually guide and drive the field, not only in our human lives and daily human lives, but also drive our work life in the IVF lab. So of course, we need to acknowledge what the artificial intelligence is. It's basically a merger between the computer science and mathematics. And it really depends what we are trying to achieve using AI technology. Are you trying to achieve efficiency, classification, or prediction? You're going to use different type of AI methods or machine learning methods. So for example, if you're trying to predict something, you're going to do machine learning. You're going to do some pattern recognition or even computer vision for any image analysis. So that really depends what type of classification or efficiency or predictions you are trying to achieve. You have to worry what kind of machine learning methods you need to use. Of course, ultimately, all these things are leaning towards automatization because that's imminent. We have to have some kind of automatization with the control of humans in any part of our lives, including IVF lab. So for me, what part of artificial intelligence can be included in the IVF lab? Starting from embryology, we can include AI in the quality control and quality assurance, evaluating sperm and identifying sperm in some difficult cases, evaluating and predicting oocyte and embryos, trying to figure out which is a top embryo or top blastocyst within the cohort of each particular patient to minimize time to pregnancy. Also to use AI to get non-invasive prediction of the embryoploidy as well as implantation. So there are different things that we can actually try to achieve. We can predict implantation or even maybe live birth, predict ploidy, even predicting miscarriages. So to start with, any IVF lab knows that needs to start with the basics, which is a quality control and quality assurance. And how we see that AI can actually influence that part. Well, AI was going to be like a big eye monitoring everything you have in the lab. And nowadays, every single machine, every single instrument in your lab has to be on some kind of alarm system, which is monitoring what's going on with that particular instrument. So what we are seeing and we are trying to achieve is that AI is going to give us preemptively what problems can occur with any of these particular instruments. So it's going to tell us way in advance when some machines are, let's say, drifting, the temperature is drifting down slowly. So we don't want to wait for the problem. We actually want to have this preemptive system that we're going to tell us, oh, you know, this machine might be going bad. You need to do something about it. So that's what we are trying to do. We are trying to do this in some preemptive way. Of course, in the IVF lab nowadays, you do need to have some kind of electronic witnessing system. It's not enough that you have multiple humans witnessing each particular dish, each particular tube, and verifying the name of the patients. That's not enough. It's not efficient. So we have a different witnessing system on the market. However, we can actually use AI for witnessing. And actually, there is a development that you can use AI even on your cell phone that will recognize the image of the embryo, each embryo, from one day to another. So it's going to recognize this is the embryo that belongs to this particular patient. And the next day, if you click the image on that embryo, it's going to tell you what embryo it is and who this belongs to. So it's very interesting that we can use AI for witnessing now. But of course, AI can be part of any part of the laboratory that we are doing. Let's start with the sperm or semen analysis. There are already machines on the market that have some level of AI involved. But there are other developments on the market which will tell us AI-assisted selection of the sperm for hESC. It's going to actually look at each spermatozoa for their velocity, motility, and it's going to suggest us which spermatozoa should be selected for injection. Of course, we are looking for some clinical studies to see what is the efficiency of these particular methods. What I'm mostly more interested in is to create AI algorithms that can help us identifying these precious sperm cells during microsurgical extractions or TESI samples. When we have hours and hours of sperm storage, and if we can have a method that can identify at least the regions where the sperm cells might be, this will be tremendous help and a tremendous way of increase the workflow. My personal note is, I believe we are creating too many embryos. And why is that? Because we are going by the quantity, not the quality. We are just stimulating very high. We are getting high number of oocytes, and we are fertilizing all of them. And we know that these oocytes are not all of them capable to fertilize normally, to create high quality embryos, chromosomally normal embryos, or create viable babies. So we are trying to see how we can identify competent oocytes. So if we have a cohort of, let's say, 20 oocytes, which of these 20 oocytes are really competent to create high quality embryos? So we don't really have to create so many embryos. We have a tremendous amount of embryos stored frozen, and these embryos were never going to be used, and it's going to stay there forever. One way to do this is by using image technology or visual technologies by looking at the images of the oocytes. And there are some algorithms on the market that can identify certain patterns within the oocyte that can be predicted how much of these particular oocytes, what is the chance for that oocytes to create blastocyst. All right, and now this is kind of coming to the clinical applications, and it can really tell us which oocytes to use primarily. Of course, we would like to see that even future. We will not only like to see that to reach the blastocyst, but we would like to see how this can predict reaching high quality blastocyst, even chromosomally normal embryos. But where is the problem? The biggest problem within the laboratory is the diversity of the opinions. Which embryos to transfer? Which is the top embryo? And even in the same laboratory, which people are trained more or less the same way, you're going to have difficulties identifying which embryo is better than the other. So there is a high disagreement among embryologists. And a couple of years ago, when we look at, let's say, AI models that are predicting high quality embryos in orange. And if we give the same images to the 5 different embryologists all around the world, we see high diversity. This diversity among opinions are because not only they are from different labs, they have a different grading systems in the laboratories, and also they have a different level of expertise. So this is the main problem in the laboratory. And you cannot really transfer information from one lab to another. In the recent ESHRE meeting, we present first study that are looking agreement among embryologists and agreement among AI algorithms. And we knew that agreement among embryologists will be relatively low, but we didn't know how low the agreement among different AI algorithms will be for the same images and the same time-lapse images. So when we look at it in the study, if we are just looking what is the top embryo, so the top embryo out of cohort of 8 embryos for each patient, we saw that overall agreement among different embryologists, it's about 60%. And if they're using some video images instead of just single image, it's raising up to 70%. However, AI algorithms, overall agreement is only 27%. While there are some algorithms that are more subjective, and there are some algorithms that more looks like just a random selection. But still, this agreement is quite low. Now, if we look at it in the second case, when we are saying, okay, clinically, what is relevant? We want to know how agreement is if we are choosing one of the top 2 embryos, not just the top embryo, but one of the 2. So embryologist agreements raised to the 85%, and AI algorithms without the random selection, it's about 75. Still, this agreement is relatively high now, but it's not coming to the 90s. So that's one of the biggest problems. The second problem is we're still doing a lot of manual work in the lab. If we are having time-lapse systems, we still have to do annotations. We still have to say, okay, how many cells each of these embryo cells have? Well, we don't want to do that. We want to have computers tell us how many cells are in each embryo. So actually, a couple of years ago, we created AI algorithm that is using images from the time-lapse and is using artificial neural networks to figure out how many cells each of these embryos have. And by using that, we were able to achieve over 93 to 95% efficiency, which means the computer can tell us how many cells each of the video images will have. So we don't have to do it ourselves. The next step will be to figure out, okay, but what about abnormal cell divisions? Can the computers really identify these abnormal divisions as well? What else we want to do? We want to just give a video to the AI algorithms, and we want AI algorithms to tell us completely what is happening in the embryo and how many cells they are. So here's the example from actually fertility. Well, the AI algorithm is recognizing 2PN, in recognizing 2 cells and 4 cells and 8 cells and so on and so on. And it's giving you also hours when that happened, which is quite interesting and important. It also can recognize when it gets to the blastocyst stage, it can recognize also the difference between the trophectoderm cells, inner cell mass cells, even give us maybe a grade of the blastocyst. So the next step will be, can we use these kind of methods to actually grade the blastocyst and give us suggestions which blastocyst is the top one. So, but let's say, what if you don't have time-lapse? What do you do if you have just standard incubators, you're looking the embryos once a day? Well, there are different ways of doing it. You can actually look at single image, mostly blastocyst, at the fixed time, let's say 110 hours, which is morning on day 5, or you can look at just random images or images just before the transfer. So there are some algorithms that are using these kind of systems. So these AIs can be also used on the single images. Of course, if you have a time lapse, then you can use the whole sequence of the time lapse to look at either the images or even adding morphokinetics to it. So how AI can help us in selecting embryos? We can use static images. That's in the input layer. We can use time-lapse videos. We can add morphokinetics. We can add some other things like omics, proteomics, metabolomics, or we can use some other clinical parameters of the patients. We're going to create pretty complex neural networks, and then depends what we want to answer. Do we want to know what is the blastocyst morphology, or ploidy, or implantation based on fetal hearts, or even implantation based on the live birth? All these things are possible. But of course, we have to be careful how we do this. So what AI can give us so far? If we are looking up to the blastocyst level, we can recognize fertilization. AI can recognize T times, or times of the divisions, can give us a blastocyst grade and even blastocyst score. So all these things are capable to do this by now. But there's other things that we are looking forward to. We are moving forward to the way how we look at embryos, from the static images or two-dimensional images. Then we have a time lapse, which just gives us another dimension of the time. But now we can actually create models of the cleavage embryos that can give us three-dimensional view. What is the organization of each of the blastomeres within the embryo? So if we can combine 3D and 4D together, we can tell us, okay, it can give us new knowledge how the blastomeres are oriented, organized, and how actually the embryo itself is developing. Now, of course, always there's a question. Of course, if you apply AI algorithms to the static images or to the time-lapse videos, what is AI really looking at? So if we have a static image, human eye can recognize maybe 20 to 30 different features on the image itself. But AI can recognize thousands of different features, from patterns, shapes, colors, who knows. For example, if we're using time-lapse videos, showing here, when we apply methods to visualize where the AI is looking at, two things we can notice. First, AI is really looking at the embryos, which is really good within the zona pellucida. But also AI is looking on the different regions of the embryo as embryo is developing. So we are hoping that AI can actually identify some novel markers of the embryo viability and tell us where to look in the future, what areas of the embryo is informative to predict viability. There are numerous papers in the recent years that are trying to apply AI even for embryo grading, even cleavage stage embryos or blastocyst stage embryos. So that's one of the applications. And they're also trying to predict implantation. Now, I will argue, of course, in predicting implantation just based on the embryo image, we should go look for the fetal hearts. If you're really looking for the live births, this is a long way to go, because if embryo is 80% of the successful baby delivery, there's other 20% of the factors that we don't know, or we are not including in these AI algorithms. So I think it will be too preemptively to go for the live births. I think we should focus in the looking in the cohort of the embryos, selecting the top embryo in the cohort, and look for the fetal hearts. There are even some efforts to try to look through the image of the embryos and predict miscarriages. These needs to be verified, but it's very promising. I think that's going to give us fantastic view what embryos to transfer or not, or even give us some ideas what embryos to biopsy and do PGT or not. So related to the PGT, there are also recently a lot of papers who are trying non-invasively predict the ploidy of the embryo. And interestingly enough, on the blastocyst level, some of these image analyses are based on the whole embryo, the whole blastocyst, just refractoderm, or just ICM. So in overall, the accuracy around 70%, but I think it's really good, because keep in mind, not even PGT biopsy are giving you 100%, okay? But I don't think we will use this particular methods to completely eliminate biopsies, but it's going to give us the option to tell us, okay, this particular embryos or group of embryos has a high chance to be euploid or high chance to be aneuploid. So then when we consult the patients, we can agree what embryos is really worth biopsying and which one are not. So in my opinion, this is the benefits or limitations of the AI in the IVF lab. First of all, it's going to give us the objectivity. We're going to eliminate subjectivity of each of the humans within the laboratory. It's going to also give us standardization, not only in the embryo evaluation, but standardization through the processes, what we do. It's going to give us precision, because we have to lead toward the precision medicine. And also, it's going to give us options to use a big data analysis. But of course, there are a lot of limitations so far. What is the ground truth? What we are looking to achieve? If the live birth is really way the ground truth should be, or should we look at it for a little differently? What is the quality of the training data? What is diversity of the training data? And what is the standardization of the machine learning methods? What methods to use for what type of data? And if these machine learning methods can be universal. Is it ready for the prime time right now? I think we have a little bit of time to see that. We need to evaluate that in the lab clinically. So the future for AI integration inside of the lab is we're going to have different AI applying to the different portion of the IVF process, starting from the patients to the stimulation, to ovarian reserves, semen parameters, embryology, ovarian stimulation, and ultimately that will give us patient outcome. But AI can actually put all these two things, all these different parts together, and it's really give us the optimal or more objective way. What is the chance of each of the patients to become a parent and have a healthy baby? But there are other things that we are looking forward in applying AI in the lab, which is automatization. There are different methods of automatization in the lab already happening, but we want to automate this to the fullest we can. So including hESC. So these are things that are in process and they are in pipeline. So we are looking forward to that because we do need some level of automatization inside of the lab. It's already happening. We have a high level of embryos that are frozen, and the cryo storage become a huge problem. We need to have a system that is going to give us control environment. It's going to give us options that we have all the time. We have inventory of the specimens. We can monitor these specimens all the time, and we know where they are. And there are already robotic systems on the market that we can use to achieve this, which will give us efficiency in the lab that is going to be much, much higher than what we are doing right now manually. But there are other things that I'm looking forward and I'm trying to also get involved. It's what I call immersive reality. It's actually extended reality, which means that you can take virtual reality and put it in the real life, like in the laboratory, or you can take a real life and put it in the virtual world. So using augmented reality, mixed reality, or virtual reality. It's going to be very interesting because you're not going to need to be in the lab all the time. You'll be able to take the image or the videos from the embryoscope and you can actually transform it in the digital formats. You can actually look at with the Google glasses or with some virtual glasses and look at it in different ways. You can rotate it and look at the details. And I think this is going to be very, very exciting. This is a new technology coming up, but I think it's going to be very, very exciting. So the question on the beginning was, is this a game changer or an effective add-on? I will say it has a huge potential to be a game changer. It's going to depend to us how to use it and how to evaluate it and can be done properly or not. And it's also going to help us to achieve automatization in the lab, which is absolutely needed, and it's going to happen. With that, anybody who is interested about application of AI, we have a specific conference that is first world conference AI in fertility this September 15 to 18 in Dubrovnik, Croatia. So anybody interested, please join us. Thank you very much.
This was an excellent lecture for my value system. This had all the elements of being contemporary, spot on. I wanted to make some comments and then invite questions. I'd like to comment on the idea that some of the technology can be used for ploidies. I think this is where we're headed, but as long as you have a standard such as PGT that can give very accurate results, I don't think we're going to quite be using this, partly because of the liability, at least here in the United States. But the other aspects that Nikica hit on was this concept of efficiency and reducing the amount of manual labor. The upsurge in IVF is only going to continue to expand. our need for these tools will concomitantly rise. It's an interesting time because AI has not quite found its footing. There's lots of possibilities. And in a recent conversation with some colleagues at a conference, I drew the analogy to trying to buy an electric vehicle, if you're into that. EVs are increasingly common, but when to buy, as the technology improves and changes, when to jump into the market is still an open question. And I kind of view the AI tools in a similar vein. So I'm going to stop here and invite questions. Eli, if you can read some of the questions, I can't quite get my image.
Yes, sure. We have one question. So great presentation. My question, when do you think the first genetic AI would come to the regular IVF lab? Thanks.
Yeah, great question. So I touched on that a moment ago. I think we are we're far away from that, I think. Here's an example of the caution I think we should exercise. There's an upward trend in the United States regarding misdiagnoses with PGT, particularly PGT-M. Now, these suits, when they're brought, are not for $50, $75, or $100,000. These are 8 figures because we're talking about long life care. So as long as we have a PGT system that's going to give us not certainty, but near certainty, anything that falls short of that will have minimal market uptake because of the attendant liability to that. The other aspect of some of these questions or these cases in the malpractice sphere is that the plaintiffs are usually the families bringing suit on behalf of their child. The child also has the eligibility to bring suit separate against the practice to that. So it's a fraught area until we have a set of tools that are equal, if not better than the PGT as it's currently practiced. I think we're a few steps away.
Thank you. And we have another question. Does AI for embryo assessment require registration with regulatory bodies? And do you know whether AI is registered for use in labs in Australia?
This is a common question, whether or not getting a mark in the EU or FDA approval. There will be an article by Carol Kircho in July issue, Fert and Sturt, that addresses this. Carol's going to review FDA requirements, what it means. This issue in July will have a separate section of views and reviews that addresses AI both in the clinic and the lab. So I think Carol's article will address your question, and I do not know the status in Australia. There was this past weekend, the Australia-New Zealand Fertility Society meeting, and there was a separate section on AI at that meeting. I think Charles Borman presented something about the lab, but I don't know the status in Australia.
Just adding from the fertility point of view, I think if someone is interested in particular one of the AI systems being registered in this or that country, probably it's better to contact directly the company.
So at the last meeting, and actually Nikica mentioned the meeting in Dubrovnik, there was one presentation about automated injection, automated ICSI. It's very, very, very preliminary, but the rudimentary tools are in place to do this. It was Santiago Monet and a few others put together a presentation with some videos. I think this is a big maybe. These things are going to happen. It's more a matter of timing and how the lab's going to embrace it. Automation is kind of interesting in the lab. Time-lapse imaging has never really caught on in the United States as it has in Europe. So it'll be interesting to see where this goes. How do we convince our clinics to spend the money on these AI systems? Great question. To make the workflow and workload easier for the embryologist. I'll extend that question and I'll add to it the clinical staff in addition to the embryologists. I can offer you some perspective from the clinic. The embrace of these technologies, any technology in clinical care, is extremely slow. I recently reviewed some literature on exactly this topic. From the introduction of the idea of evidence-based medicine to the actual uptake of it by most practitioners was 7 years. So the idea that you can change clinical practice, laboratory practice overnight, I think, is misleading. This is going to take time, convincing people, making them feel comfortable and confident that this next step of AI is going to make life better. I think we have to better understand how people will view these tools and use them effectively. And I don't think we're there yet about understanding fully the culture of work in the lab and how to integrate new tools. I think that the driver, in direct answer to your question, the driver of doing this will be cost savings. Marginal increases in outcomes, although the gold standard, I think we'll need a little bit of more energy in terms of cost savings to really start to have clinics looking at these critically. I hope that answers your question, but it applies both to the clinic and the lab. Thank you, Victoria, for that question. Thank you, everyone, for participating, and I hope to see you next session in 3 weeks. We'll sign off. Thank you.